from the other thing, there's a security camera in that room.
All right, we're going to go ahead and get started. And I'm just making sure all of my screens and monitors are. We're going to go ahead and get started. I actually see my phone needs to be charged, so I am going to go and do that, and I will return. Okay, for some reason you're not seeing me on the screen, and I apologize for that. Let me see if I can figure out how to make that work. Just a second here. Oh my goodness, come on now. I hid them, but they shouldn't disappear. Oh my goodness. All right, well, so let's see. Now, video panel. Turn my video on. There I am. Hi, everybody. Thank you so much for joining me today. I am really excited to be bringing you this presentation, and we're doing this as a YouTube Live. I've tried this a couple different times. Hopefully this one will be successful. Today we're going to be presenting the Ready Set Baby free virtual new parent prep event. And these are your birth options, and letting you get an opportunity to figure out what the different things are that you need to be deciding when it comes to your pregnancy, your labor, and of course the birth of your child. And also, we're going to talk about a couple of the things that you may need to decide for your baby when your baby is born. There's decisions that need to be made after your baby is born too, for their benefit. So I'm going to go ahead and share my screen, and we're going to get started. So we're a little bit backwards. This is the agenda. We're going to go back because I wanted to tell you a little bit about America. America was one of my first clients. She had come to the United States from Puerto Rico, hoping to have a vaginal birth after having had a C-section 9 years prior. And she worked hard and prepared. She actually came to my class twice and used all the tools in my bag, and she did everything that she was supposed to do. But unfortunately, America didn't dilate. And so despite all of the prepping and planning, she did have a second C-section. But America was not traumatized by her experience. In fact, she was prepared and understood what the possibilities were. I was there with her, holding her hand, and I got to actually take a picture of the baby, 9-pound, 4-ounce baby girl, as she was brought into the world and took her first breath. And then a few weeks later, after the baby was born and America had gone home, her mom had been able to come and visit her. And I actually ran into them in town. And when America introduced her mom to me, her mom gave me the biggest hug and thanked me for being there for her baby when she couldn't be. And that just really helped cement that what I was doing was important, and reminds me why I still do what I do today and how we can still do much better. So while America had a positive birth experience, nearly 40% of women report their birthing experience as traumatic. It's time to change that. So we're going to talk a little bit about emotional and physiological aspects of birth, education and beliefs, preparation for birth, understanding and minimizing risks, ACOG recommendations, childbirth in the U.S., birth options, medical interventions and policies, choosing your team, choosing a birthplace, and then putting it all together. So again, I want to welcome those of you who don't know me. My name is Susan. I'm Susan Finazzo, the founder of My Baby Lady and the Ready Set Birthing Childbirth series. I'm a certified doula, a childbirth educator, a baby planner, and a faith-based counselor. As a holistic wellness and perinatal specialist, I support families through childbirth, postpartum, and parenting with an evidence-based approach to balanced wellness. I'm here today to guide you every step of the way. So my sincere hope is that you leave today feeling more confident and competent. Whether we work together or not during your pregnancy, today's presentation should give you a solid foundation to start. So, do you have a clear vision of what you'd like your birth to look like? Maybe you've thought about it in detail. Maybe you haven't given it much thought yet. If this is your first baby, you might not even be aware of all the choices that are available to you. And if it isn't your first time, maybe you're hoping for a more positive experience this time around. Either way, taking time to explore the different birth options and the scenarios and getting clear on your top priorities can make a big difference as you prepare for your childbirth journey. These are just a few of the very real fears that people face during pregnancy. Identifying your fears, addressing them, and working through them ahead of time can lead to a more comfortable, confident, and empowering labor and birth experience. By noticing and understanding your fears, you're taking the first step to face them and to move past them. This helps you to focus on having the best and most positive birthing experience possible. Taking control of your fears can make you feel stronger and more ready for what's ahead. Some situations, such as emergencies, are simply beyond our control. However, understanding the options that are available to you, both when you have choices and when those circumstances might limit, and when your circumstances might limit those choices, is crucial to your being comfortable during labor. This knowledge, it empowers you to help you make informed decisions. It helps you to remain adaptable, to feel more confident, no matter what path your birth experience might take. So recognizing your fears is a huge first step towards moving past them. By understanding what worries you most, you begin to take control and shift your focus towards a more positive birth experience. Facing those fears head on helps you feel stronger, more confident, and ready for what's coming your way. You're entering one of the most meaningful and transformative seasons of your life. And the choices you make now, especially around your health care and your birth, may matter more than ever before. According to the American College of Obstetricians and Gynecologists, shared decision-making and respectful evidence care are key components to a safe and satisfying birth experience. Most parents want the same thing: a safe birth, a healthy baby, and a positive experience. But what safe, positive, and healthy look like can even vary from person to person. So ACOG emphasizes that care should be individualized and aligned with each birthing person's values and preferences. There's no one-size-fits-all approach to childbirth. Studies, including those cited by the World Health Organization, or WHO, show that childbirth education, emotional support, and person-centered care can improve outcomes, reduce unnecessary interventions, and increase satisfaction with the birth experience. So learning and preparing ahead of time can help you understand your rights and your concerns, understand your options, reduce stress and fear during labor, can help you make informed decisions that support your values and your goals. The steps we'll walk through together are grounded in the latest research and recommendations from leading health organizations. They're designed to help you feel informed, supported, and empowered so you can confidently navigate your labor, birth and that beautiful journey into parenthood. So start by understanding your unique situation, exploring your options, and identifying what matters most to you. You want to create a birth plan that aligns with your goals, and you want to share it with your partner and your support team so that everybody knows how best to support you. By staying informed and prepared, you'll feel empowered and ready to navigate your birth experience with confidence, making it the best it can be for both you and your baby. Childbirth isn't just about the physical process. It's shaped by many factors: your health, environment, medical options, emotional readiness, support system, and even cultural and societal influences can play a role. So when you consider all these aspects, you'll feel more prepared and confident, knowing that you've thought through all the different parts of the experience. And this helps you approach birth with clarity. Taking time to identify your feelings about birth and exploring why you feel that way is another important step in creating a meaningful and positive birthing experience. By understanding your emotions, your concerns, and your hopes, you can set clear goals that align with your values and your priorities. This self-awareness allows you to make informed decisions, advocate for your needs, and approach your birthing experience with confidence and purpose. When you understand your feelings, worries, and hopes for birth, you can set clear goals that matter for what truly matters to you. This awareness helps you make good decisions, speak up for your needs, and face your birth experience with confidence. It's about knowing what's important to you and feeling sure about those choices that you make along the way. And now in the Zoom room, if I had a group of people all together, I would put a poll up and we would get a result. But this is just for your own personal reflection as you're watching and following along today. Which of these has been most influential in your views and feelings about birth? Has it been friends, family, your own research, TV and movies, or is there something else that's been impacted what your thoughts and beliefs about birth is today? So, of course, one of the best ways to learn about your options is to take a childbirth class. Knowledge is power. And when it comes to childbirth, being informed isn't just helpful, it's essential. Parents who understand their options can make confident, informed decisions, and they can advocate for the childbirth experience that they want. A well-rounded, comprehensive childbirth education class isn't just nice to have, it really is a must. You want a class that equips you with practical, evidence-based information, that includes your partner and support team, ensuring everyone is prepared, that teaches communication strategies to help you advocate for your needs, that provides hand-on comfort measures and labor support techniques. Now, we certainly don't have to work together, but I am a childbirth educator, so I do want to share what I offer. I offer a dynamic, interactive 3-week childbirth preparation course. It's 3 nights, 3 weeks in a row, 2.5 hours each session. So it's a 6-hour deep dive into childbirth education for expectant couples. And the goal is that you leave prepared, confident, and supported. I'd love to have you in one of my group events, but whether you take a class or not, make sure that you are truly prepared. Find one that prioritizes partner involvement, communication, and hands-on labor comfort strategies. Your birth experience matters. Let's make it an empowered one. So this is another one that I would put up in a poll if we were a group all together in a live in a live, in a meeting all together. During the class, I would put up a poll for this. So you want to remember that your feelings do matter. Taking the time to acknowledge and understand them is a powerful step towards creating a birth experience that feels empowering and fulfilling. When you tune into your emotions, you can express your needs with clarity and confidence, helping your partner, your healthcare providers, and your support team support you the best way possible. You deserve to feel heard, valued, and cared for every step of the way. And just so you know, every one of these is a perfectly normal way to feel. And sometimes you feel one or more of these at any given time. So we're just going to go through this. This would also be in a poll, but since I'm doing this as a live stream, we're just going to go through each one of these questions and for you to consider whether you agree, disagree, whether you strongly disagree or strongly agree, or whether you're not so sure about some of these beliefs, to get an idea and gauge where you might want to do some research or where you know you definitely don't need to do any research. So birth is a normal, healthy event, and my body knows what to do. Is this something that you agree with, disagree with? Not really sure. Most women can safely give birth with minimal medical assistance. How do you feel about that statement? What happens during my labor and birth doesn't really matter as long as everyone is okay in the end. How do you relate to that statement? The process of giving birth can be safe and joyful. Do you agree or disagree? Along with having a healthy baby, my birth experience is also important. Maybe, maybe not so sure. And last, my provider should give advice, but my partner and I should make the final decisions about medical care. Do you agree or disagree with that statement? Is that something you're not so sure about? There are risks involved with many things in life, including pregnancy and birth, but there are strategies that help keep your risk as low as possible. Take traffic laws, for example. Staying alert, wearing your seatbelt, these are crucial steps to reducing accidents and injuries. Similarly, with birth, like driving, there are risks, but just like with driving a car, there are proactive steps you and your birth team can take to influence those risks. Sometimes, however, the overuse or misuse of certain tools can do more harm than good, increasing risk rather than reducing it. For example, while wearing a helmet provides an added layer of protection, when driving, it could also limit your visibility, potentially making an accident more likely. Helmets are typically worn by those at a higher risk, like a motorcycle driver or a race car driver. Similarly, going 20 miles an hour under the speed limit might be necessary in a rainstorm, but could actually be dangerous and irresponsible under normal, clear conditions. Just as with any situation, it's important to use the right tools and strategies at the right time, balancing safety with practicality. We are very fortunate to have access to the many life-saving medical advancements that we have access to. But just because we can use the tool doesn't mean we always should. Medical intervention, tools, technology, and medications are used in most births today, but they carry risk when used inappropriately. They carry risks, and when used inappropriately, can cause harm. Using an evidence-based approach, can help improve outcomes when dealing with interventions, as well as improve satisfaction rates. The American College of Obstetricians and Gynecologists have stated these goals written on the slide. The United States is in a maternal and infant health crisis. We are the only nation that has doubled its maternal death rates in the last 30 years. And they continue to rise. Our infant mortality rate ranks 33 out of 36 developed countries. Cesarean deliveries, while life-saving in emergencies, are performed far too often, with 33% of our births here in the United States being surgical, double what the World Health Organization recommends. Half of these are considered unnecessary, which means we're putting mothers and babies at serious risk of complications unnecessarily. And even worse, Black women are facing a deadly disparity. They're 3 to 4 times more likely to die from pregnancy-related causes than white women, regardless of education or income. And Black infants are also significantly more likely to be born too early, to be born with a low birth rate, or not to survive the first year of life. This is not just a statistic, it's a human rights crisis rooted in systemic racism, unequal access to care, and a medical system that often overlooks the needs of the marginalized communities. So, what does ACOG suggest? They suggest improved birth outcomes, increased health, increased satisfactions, and lower intervention rates, including C-sections. And how do they expect us to do that? Shared decision-making between parents and providers mean that parents need to be empowered through education and support. Movement and position change during labor are not just comfort measures, they're evidence-based practices that facilitate labor progress. Yet hospital protocols still limit movement, tethering women to beds unnecessarily. Encouraging freedom of movement prevents unnecessary intervention and leads to healthier outcomes for both mother and baby. To understand the current culture of America, let's examine how it's evolved over time and how these medical interventions became common in the first place. So before 1900, women typically gave birth at home, attended by a midwife and female family members. Birth was viewed as a natural biological event. However, limited understanding of hygiene and the lack of advanced medical care for emergencies did lead to a higher mortality rate compared to today. In the early 1900s, doctors and hospitals introduced what was known as twilight sleep, a combination of narcotics and anesthesia designed to relieve pain and induce amnesia, ensuring that women didn't remember anything. The appeal of pain relief, combined with the growing prestige of a hospital birth, drove a sharp rise in hospital deliveries, and birth became a very profitable business. In order to streamline and to control the process, hospitals implemented policies that excluded husbands and family members from the birthing room. Improvements in hygiene and medical practices contributed to better outcomes for mothers and babies, but twilight sleep carried serious side effects for both. And some women experienced severe traumatic experiences from it. In the mid-1900s, a movement emerged that would be Dr. Lamaze, advocating for reduced fear through education and promoting alternative pain management options. Twilight sleep was gradually replaced with other pain medications that had fewer side effects. Ultimately, being replaced with the epidural, which has become the gold standard of pain relief care for births in hospitals today. Then in the late 1900s, around 1990, the C-section rate steadily increased for 10 years, just kept going up, 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 up. Doctors began performing them more frequently. Even when women were eligible to have a VBAC after a C-section, they were still scheduling C-sections, and C-sections became just became more and more popular till they're, like I said, at 33% today. The effectiveness of many routine medical procedures, such as episiotomies, having a continuous heart fetal monitor, and breaking your water prematurely, or artificially breaking your water, has inspired a lot of research and debate. These and other procedures have been found to lack benefit when used routinely, but many providers and hospitals are just slow to change. Despite medical advancements, the United States is behind all other industrialized countries in health outcomes for mothers and babies. How is that possible? And let me just give you some numbers so that you can kind of wrap your head around this a little bit. In the year 1979, the C-section rate was 15%, half of what it is today. And our government back in 1979 thought that was too high. They convened a special panel with the goal of decreasing that to 10% by the year 2000. And instead, here we are in 2025, sitting at 33%. What we're doing is not working. And we know it takes an average of 17 to 20 years for evidence to become standard practice in the hospitals. We just don't have that kind of time. So this is where my baby lady and people like me come in. As a doula and a childbirth educator, my mission is to help parents navigate the maze of pregnancy, childbirth, and postpartum with confidence. I offer evidence-based education, one-on-one consultations, and sessions like a mock Labor Day to equip parents with practical tools for a smooth journey. Acupressure for morning sickness, birthing balls for preparation, and advocating for yourself through tools like a birth plan and using the BRAIN acronym are methods that just a few strategies for empowering yourself during childbirth. So basically, we have two approaches to birth. We have the physiological approach, which is a natural or unmedicated birth, which allows for a faster recovery, less risk of infection, greater freedom of movement. It promotes active participation, a sense of accomplishment, and a smooth transition for the baby. It also supports the release of important birth hormones and encourages early breastfeeding. Heather, one of my clients who had 2 C-sections before achieving a vaginal birth, faced opposition from both her doctors and even her husband initially. But with a physician finally willing to collaborate, we prepared, practiced relaxation techniques, advocated for her choices. Heather went into labor naturally at home, arrived at the hospital 7 centimeters dilated, and had an unmedicated vaginal birth that she dreamed of, despite all the bells and whistles that were needed because she was considered high risk. Disadvantages of a physiological birth: it does require preparation and commitment. There is that risk of disappointment or grief if interventions do become necessary. And full-strength labor without medication for pain relief can be intense and very overwhelming. Our second approach would be a medically managed birth, where within the hospital setting, you're offered the opportunity to have pain management A medically managed birth uses technology, tools, and medications to prevent, diagnose, and treat complications. The availability of close monitoring is absolutely crucial for high-risk situations. The availability of advanced medical technology ensures that emergencies or sudden complications can be addressed swiftly. Hospital settings also provide more control over the timing of the birth, allowing for scheduled inductions or C-sections if needed. And additionally, pain management options such as laughing gas and epidurals are readily available to help manage pain levels and provide comfort during labor. Katie had an amazingly fast induced labor at 41 weeks. She opted for an epidural just shy of reaching full dilation. Katie was able to rest and refocus, and when it was time to push, she pushed for only 10 minutes for her first baby. Sometimes a combination of these two approaches can be best. Disadvantages to a medically managed birth is that interventions can offer crucial support, but they do also introduce potential risk, both for mom and the baby. One significant concern is the cascade effect, where one intervention leads to a series of additional procedures, increasing the likelihood of complications. Hospital births also tend to limit the birthing person's mobility and autonomy, as medical interventions often require monitoring and restricting movement. So they can reduce the sense of control and freedom in the labor process. Weighing your options. Deciding if and when to use an intervention involves weighing all the information: the reason for using the intervention, the seriousness of the situation, what your preferences are, what your provider's recommendations are, and then the current evidence. This is where you use the brain analogy. BRAIN, benefits, risks, alternatives, intuition, not now or nothing. What are the benefits? What are the risks? What are the alternatives? What does your inner voice or your intuition tell you about the situation? And what if we do nothing now or not now? We want to take all 5 of those factors into consideration before making a decision. Be flexible. Choose an approach that appeals to you and then take the steps to help you achieve that goal. But remember that labor is unpredictable. Sometimes you will need to make changes to your approach. So being flexible and patient, especially with yourself, are crucial. The following is going to provide an overview of many birth options that may be available to you. For each topic, you want to consider your preference and your priorities. So inductions and interventions to speed up labor are very common, but it's important to consider how and when you want labor to begin and progress. Have an open discussion with your care providers ahead of time about policies and procedures, including breaking your water, vaginal exams, induction methods, and pain management options. Hospital policies and culture vary widely, so it's essential to understand the hospital's approach to things if you're having a hospital birth, or the birthing center's approach to things if you're choosing a birthing center. You want to know what their thoughts are on freedom of movement, support from doulas, food and drink options, visitors, video and photography. Identify specific amenities or equipment that matter to you, such as a shower or a tub, or a portable fetal monitoring equipment. Think about the preferences for the birth itself. Do you have strong feelings about how you might want to push? Is there a position you think you might prefer? Consider your wishes about cord clamping, about perineal support, whether you would prefer an episiotomy or whether you're open to the possibility of tearing. In the hospital that I spend most of my time in right now, they don't do episiotomies at all anymore. If you tear and they sew you up. I've been amazed at how few of my clients actually need stitching even after having their first babies and even after some big babies have been born. I'm not saying they've all gone without needing stitches. I would say that it's a good 50-50 shot as to whether or not a mom is going to tear without that automatic going for the episiotomy. So it's important to educate yourself about the hospital's policies and procedures regarding cesareans in case of an emergency. Understanding your options ahead of time can help you feel more prepared should a C-section become necessary. And you'll have options for the baby's care after birth as well, including vaccines, health screenings, circumcision if he's a boy, the timing of your baby's first bath. Now, ideally, if there's no medical reason to delay, you should have at least 1 and even up to 2 hours of skin-to-skin contact before any procedures are necessary to allow you to bond and then initiate that first feeding with your baby. This would be another poll if we were all together in a class, but I'm just going to go through the slides and have you consider what your answers would be about these and what ones you might need to consider doing more research or investigating on. So what kind of an environment and support do you need during labor? I recommend laboring at home as long as possible. And the reason for that is you could possibly show up at the hospital only dilated 2 or 3 centimeters, in which case they may send you home. So you want to make sure that you have a good, strong, active labor going, that those contractions are making cervical change before you go to the hospital. So laboring at home, you want what kind of an environment is your home going to be while you're at home laboring? Would you prefer a calm and peaceful space? Or would you prefer company and family and friends over? Or would you prefer minimal distractions and interruptions? And this is just what you think you might want at that time. You may feel very different in the moment, and that's okay. How do you feel about continuous monitoring versus intermittent monitoring? Continuous monitoring would mean you would be stuck in the bed or on a chair next to the bed. You wouldn't be able to move very far because you would have the monitors, as you see in these pictures, strapped to your belly until it was time to actually push and birth your baby. Whereas intermittent monitoring usually consists of 15 minutes out of every hour in that position, and then they take the monitors off, and for 45 minutes you get to move. Or how do you feel about having the freedom to move in general? Your thoughts on medication to start labor or to speed up labor? How do you feel about frequent vaginal exams? Every hospital is different. The current hospital that I spent had most of my most recent births in, their standard of care is they don't check but for every 4 hours unless there's a significant reason to do so. And how do you feel about having your water broken to help speed up labor if labor is stalled or the baby is high up? Sometimes the doctor or the midwife will recommend breaking your water to help move labor along. Now, an IV access in most hospitals is non-negotiable. As a patient in the hospital, they will require you to have an IV access. You might not necessarily need to be hooked up to anything, but they will want one so that should an emergency arise, you can be. What are your thoughts on the epidural? Is it something that you have thought about or haven't done much thinking about? Narcotics are very rarely offered these days. but it is something to consider if that would be a better option for you than an epidural. How do you feel about episiotomies? You want to ask your doctor, do they routinely do an episiotomy these days? Or are they more open to letting you tear it if that were to be the case? How do you feel about a vacuum or forceps for assistance in delivery? And what are your thoughts on C-sections? What do you know about where you're planning on giving birth right now? And if you don't know where you're giving birth right now, these are things that you may have a preference for, or you may not. But if you have a preference for them, you definitely want to ask your current place of where you're planning to give birth, or the places you're going to look into as possibilities of where you're going to give birth. Do they give you choices and explain those choices? Do you have access to a shower and a tub? Will you have freedom to eat and drink during labor? Can you wear your own clothes? Choose your birth position? Push instinctively? Or have extra people there at birth if you choose to have people there? Or the possibility that you're giving birth where they would bring extra people in and you have the option of saying no, you want any extra people that are in the room to leave when it's time for you to actually give birth. Now, hopefully you would not want to avoid immediate skin to skin or delayed cord clamping. We encourage you to accept the medication to control bleeding to be delivered after the placenta is born. So it's after your baby is born to control bleeding. The baby is the baby is not subject to the medication, but it is standard procedure. You do have the right to refusal. So if you're not sure how you feel about that, you may want to do some research. If you don't have a preference, you'll sign the paperwork and they'll automatically give that medication to you if you're having your baby in a hospital setting. Midwives, home births, and birthing centers vary from institution to institution, so you definitely would want to find out what their policies are. How do you feel about the eye antibiotic? All babies get an eye antibiotic automatically placed. It's like a little Vaseline that gets smeared on their eyes. It's to prevent STDs in the event that mom could have possibly passed an STD on to baby. And then the vitamin K injection. Vitamin K injection is not a vaccine. It is truly a vitamin. Vitamin K is the vitamin that helps our blood clot, and it was discovered back in the late 1800s by a doctor that a simple injection of vitamin K practically eliminated the babies dying from brain bleeds. Babies would be dying from brain bleeds without knowing the cause because babies' baby's blood has no ability to clot. It takes a little while for the body to build up that vitamin K and for that clotting factor to take hold. So the vitamin K injection virtually eliminated babies dying from brain bleeds after that became a standard practice. I think in the early 1920s, I believe, is when it became standard practice. There are some midwives and home birthing midwives that will offer vitamin K drops. I don't believe the hospitals, at least the hospitals here, don't offer the drops. They do not believe that they have sufficient evidence to prove their effectiveness. So it would either be accept the vitamin K injection or sign a waiver that you're refusing it. Other newborn care things to consider, again, if you're having a little boy, whether you're going to circumcise, if you're planning on exclusively breastfeeding, hospitals, I think nationwide, assume you're going to exclusively breastfeed. So if you're planning on not breastfeeding, or if you're planning on supplement feeding, you want to make sure you have something there at the hospital to feed the baby when the baby's first born. How do you feel about the hepatitis B vaccine? That's a standard routine, but you do have the right to refuse. I have a lot of times where moms just want to talk to a pediatrician before they have that shot given, so they refuse it at the hospital. But once they've talked to the pediatrician about it, they go ahead and consent in the doctor's office. So that's not something that you have to make a decision about right away if that's something you want some more information about. Delaying the baby's bath is usually common practice in a hospital. And then rooming in, unless you're having a hospital that doesn't have a birthing center within the hospital, rooming in should be an automatic. So I mentioned the impact of choices earlier, how one decision can lead to the use of further interventions, and this is referred to as the cascade of interventions. Before making a decision, we want to consider the big picture, including other interventions that may also be used and increased risks from that intervention. So the cascade of interventions refers to a chain reaction that often starts with labor induction or augmentation. So it usually starts with an induced labor. Mom's either gone beyond her 40 weeks, or she has some type of a medical risk that warrants an early induction, or she's gone into labor, but she's been laboring for a long time, and now the medical staff is suggesting intervention with some medication to help speed that labor up and move it along. This would be using Pitocin most specifically, which can lead to stronger, more painful contractions, thus leading to the possibility of an epidural, which could slow down labor and does limit mobility. Now, I have seen an epidural actually help labor speed up, but it does restrict you to the bed. It does require an intravenous drip. It does require a bladder catheter. So it increases the risks of the possibility of a bladder infection. It increases the risks of your contractions weakening. That might lead to another intervention of having your water broken, which could possibly lead to an infection, which also could possibly lead to a C-section. Excuse me. When you reduce your mobility, it can also prolong labor and increase risks of complications such as fetal distress, resulting in, again, further interventions, as I said here, and it shows on this flow chart, all the way up to the possibility of a C-section and even further along with postpartum complications. Each step increases the likelihood of an additional step, highlighting the importance of informed decision-making and supporting natural labor progression whenever possible. So choosing the people around you at birth may include your partner, friends and family, a doula, maybe a professional doula. Maybe you've assigned your sister or your mom or somebody else to be your doula. It's helpful that you choose people who support your goals and avoid people who create tension or fear for you. So like if you don't get along with your mom, you don't want your mom there. If your mom is your best friend, she could very well be the perfect doula for your birthing situation. So in many hospitals, nurses provide most of the care during labor and you see them like every 4 hours. So you're not going to expect to have them until it's time to push. Obviously, when you're pushing, you'll have the whole medical team there for the duration of the pushing until the baby is born. Um, you may have residents and on-call physicians, interns, or assistants, but as long as you're not in a teaching hospital, you can request that no extra people be in the room. This isn't something you might think about at that time. So if you don't want additional people in the room, make sure that you put that on your birthing plan and that your support team knows. I have been the person in charge of it's time to start pushing. Everybody needs to leave the room except for those that are required to stay. So put that on your birth plan if that's something that's important to you. Now, studies do show that having a doula reduces the likelihood of a C-section by 50%, reduces the length of your labor by 25%, and lowers the use of interventions like Pitocin and epidurals. Continuous support is a game changer, bridging the gap between the medical team and parents to ensure they feel empowered and heard every step of the way. And that doesn't just mean hiring a doula. You can bring somebody in. I do offer an individualized plan where I work with you and your birth team to help train somebody to be your doula in the birth setting. You may have an OBGYN, your family doctor, or a perinatalist. If you have any kind of risk factors, you would have an OBGYN and a perinatalist. You may have a midwife mixed in with that group. A midwife mixed in with that group would be a certified nurse midwife. Certified nurse midwives are the nurses that are the midwives that that help birth in hospitals. A direct entry midwife or a lay midwife or a certified professional midwife would be a midwife that would do a birthing at a birthing center or a home birth. So your care provider has a tremendous influence on your birth experience. So if it's early enough, you want to begin a conversation to learn about them, ask them about a typical birth, what their rates for induction C-sections and unmedicated births are, get a hold of their policies and preferences. Anything that's important to you, you want to ask them. You want to interview your provider if you're fortunate enough to have options to choose a provider. Some people, unfortunately, their insurance tells them who they can see. Some women, based on when they're due, can only find one provider that's able to take them. So this is giving the understanding that you have the option to interview multiple providers. So these are a couple of questions to ask. And even if you don't have a choice between providers, these are good things to know about your provider. What is their approach to prenatal care and delivery? How often will they provide checkups? And what will each appointment entail? What should I do if I have concerns or complications between appointments? Do you go to the ER? Do you call the nurse hotline? How do you involve your patients in decision-making and care? What is your approach to managing postpartum care and recovery? What is the most common choice for pain relief among your patients? What are your thoughts on birth plans and how flexible are you if things don't go as planned? What's your C-section rate and under what circumstances do you recommend a C-section? And then what percentage of your patients have spontaneous childbirth with few or no interventions? It's important to have a trusting and healthy relationship with your provider if at all possible. Does their philosophy and approach match yours? Are you comfortable speaking up? Are your questions welcomed? How do you feel after each appointment? You should look forward to your prenatal visits. And if you're not compatible, are you willing to find a new provider if possible? Because Coercion is real in the medical field. It uses emotional manipulation or threats to influence your decision. It is unethical, but I see it all the time. So if you have a provider that makes you feel guilty, belittled, bullied, afraid, ashamed, or powerless, you want to look for a new provider if at all possible. You want to beware of providers saying things like, why don't you just relax and enjoy your pregnancy? Or let me worry about that. Or I just find it works better this way. Or it's not up for discussion. Or I've had other patients regret that decision. Those are the kinds of things you want to be on the lookout for. That you don't want to hear those kinds of things from your provider. So choosing a birthplace, you will labor most comfortably and effectively when you are supported and encouraged and when the environment around you is safe and secure. So your choices are a hospital, a birth center within a hospital, an independent or freestanding birth center, or home. We'll look at them real each individually. At the hospital, every hospital has its own culture and its own policies and procedures. If you have a choice of hospitals, you want to ask each of the hospitals that you have a possibility of attending what their C-section rates are, what their epidural rates are, what their induction rates are, what restrictions they pose on laboring women. Do they offer birth tubs and showers? Are midwives on staff? And are doulas welcome? Those are important questions that you want to ask the hospitals that you have to choose from. And then when it comes to a birth center, if you're considering a birth center, you do need to consider location and cost. There's usually hospitals, within a certain proximity. A birth center, you may be near one, but you may have to travel for one. Are you willing to travel the distance to a birthing center? What is the length of stay? Typically, birth centers, you leave within a couple of hours of the baby being born. After the baby's had his or her first bath, it's usually no more than 3 or 4 hours after birth that you're discharged to home. You want to know what might cause somebody to risk out to be transferred and what those transfer rates are. Do they have medical equipment and supplies on hand? And then do they offer you any pain management options? Some birth centers offer a sterile injection, which is something that people have said helps with the pain. And some also offer nitric oxide. Other than that, in a birthing center, that's pretty much the only choices you would be offered, other than, using acupressure and movement change, position change, and so forth. And then at home, if you're thinking about having a home birth, you want to consider finding a care provider that you can either afford out of pocket or that your insurance will cover. You want to look out for a physician backup just in case you have complications or concerns. There are no laws against having a home birth with a licensed home birth provider. You also want to look at risk factors. If you have any risk factors, a home birth might not be an ideal choice for you. You want to make sure you know what your transfer options are. And of course, with a home birth, there are supplies that you are going to be required to purchase and have on hand for the birth. Each midwife and midwife collective will direct you to where you can go online and order whichever kit it is that they recommend that you purchase. And then you have that kit when the day comes, so that when the midwife shows up with all of her stuff, you'll have the tools that she's relying on being there. So learning acupressure for morning sickness and labor progress, using a birthing ball for perinatal support, and advocating for yourself through tools like the birth plan and using your brain or bra. I said, if you forget your brain, don't forget your bra. Benefits, risks, alternatives. Whenever faced with a decision, you want to know those 3 things. What are the benefits? What are the risks? What are the alternatives? You want to take into consideration your intuition, and you also want to ask, what about doing nothing now? But if you forget all 5, remember the 3. And empower yourself during childbirth as you put it all together. Sharing your preferences is identifying, discussing, and researching the important topics, the things that you've decided are important for you. Maybe you don't care if you're in a hospital gown. Maybe you have a nightgown that you've already picked out that's going to be your birthing, what you're going to wear to birth. Everybody has different priorities, so establish your top priorities. Decide what is negotiable. Evaluate your unique current situation, and then write down your preferences. Start that birth plan. If you've already decided to birth in a hospital, a lot of hospitals will start you off with a birth plan worksheet. You want to fill out, answer all those questions. Sometimes it's 2 or 3 pages, but then you want to take all that information and transfer it to a 1-page document that you can hand to the doctors, to the nurses when you go into the hospital or to the birthing center, or that you can hand to your doula. Well, your doula should have it if you've been working with your doula, but one for you, one for your each of your caregivers, and then discuss them as you're writing them down. Before the day, there's always room for revisions. So discuss it with your provider and then revise as necessary until you're comfortable with the plan that you've put together. And then, now that you've gone through all the steps, release the need to control the outcome. Have confidence that you've done your part and trust yourself and your birth team to guide you through whatever your birth experience may bring. So it should, like I said, be 1 page. You want to have your name, your support people's name on it, your provider's name, and then your preferences for birth, just bullet points. You're going to go through that worksheet if you have one. If you don't have one, you can go to mybabylady.com. I do have a birth plan where I believe I have a birth plan worksheet. If I don't have one on the website, you can text me and I can send one to you. My phone number is on the website, mybabylady.com. You're going to see it on a slide here in a few minutes. If you don't have a birth plan worksheet, you can also go to babycenter.com and download their birth plan worksheets. You fill out the worksheets, then you take that information and you make bullet points for your birth preferences and then for your baby care preferences. And then any other important details, if you have any medical concerns or risks, those are important to have on there as well. Just a reminder of what it means to use your brain. Benefits, how does this help? Risk, what are the potential problems or side effects? Alternatives, what other options are available? Intuition, what does your gut or inner voice say? And not now or nothing, can we wait or decide later? And I love this saying from Penny Simpkins, feeling in control, not necessarily of the labor, but of your response to it and of the decisions being made, and feeling well cared for are more important to your long-term satisfaction than whether your labor was easy or difficult, normal or complicated, long or short, painful or pain-free. So birth is not just a medical event, it's a life-changing experience. Educating and supporting families not only improves outcomes, but also empowers parents to trust their bodies and their instincts. We want to ensure that every family, regardless of race or socioeconomic status, has access to the care, support, and resources they need for a safe and empowering birth. As a country, we must do better, reducing maternal and infant mortality stats with giving families the tools and support they need. This includes investing in equitable health care, increasing access to maternal care, and advocating for paid family leave. No one should be left behind, especially the most vulnerable communities. So I am here to provide personalized, comprehensive education and support tailored to your needs. I am a verified Florida Medicaid provider, meaning that Florida Medicaid clients can receive my services at no cost. Visit mybabylady.com to connect with me via Zoom or text me at 407-973-4620 and let me know you'd like to set up an appointment. You can also visit mybabylady.com and schedule a free 30-minute consultation. And that does conclude our Ready Set Baby free event. If you're still here and are interested, I have not changed this slide. It is no longer a special offer just for people who attended this. I have made this available for $150 for anybody that wants to sign up. For all 3 days, it's 6 hours of comprehensive childbirth education, and you can sign up. The classes are Tuesday evenings from 6:30 p.m. to 9 p.m. Eastern Standard Time. It's not every month, so you do need to look and see when the next class is being offered. I had a class this month in September. If I get a large response of people interested and I don't have one scheduled, I'm happy to add one onto the calendar. But right now, you want to look to see when the next one is scheduled. During that, you'll learn what to expect during each stage of labor and how to navigate birth confidently. You'll understand the most common variations in labor and birth and the interventions that are used most often in these circumstances. You'll learn techniques and tools that can help you practice so that you can have increased comfort during labor. We will talk about medical and natural options to help you cope with the pain. And we will also discuss how your support people can help you feel safe and empowered. We'll go over postpartum adjustments for immediately after birth, along with the first few days after. We'll talk about your newborn and preview many normal qualities that you can expect. We'll go over all the procedures that are normal and expected if your baby is born in a hospital and if your baby is born at home. We'll also discuss the needs of a newborn for newborn care, and we'll go over breastfeeding basics as well. Now, if you're still hanging on and you're curious about virtual doula support, this is a special that you're only going to see today. For attending today and staying all the way to the end, I've opened 6 spots and I'm offering a coupon for my 8-week virtual comprehensive childbirth class and doula support plan. Okay, you can get this for yourself or you can even gift it to someone. The coupon's good through the end of 2025. It's good through December 2025. Just to show you, this is what my normal virtual doula package costs by itself. And then if you were to add each of the individual things and purchase them separately, this is how much my services would cost. I don't charge that. I pull it down and I break everything down the middle, and I only charge $11.45 for all of my services together. But today, if you write down this code, MBL2508, you can get $250 off of that package, meaning that you would get all of that for only $895. If you're interested in that, you can call or text, but make sure you mention MBL 2508 to get that $250 coupon. The 8-week package includes weekly check-ins and phone supports starting 7 days and phone support starting 7 days before your due date. You get unlimited text, continuous and intermittent support all during labor and during your birth via phone, text, video call, Zoom, or Messenger, whatever's most convenient for you. You get the 3 2-hour comprehensive childbirth education group events. Well, this one you've attended, then you'll also get the 3-day masterclass. It's also included in this cost. You get virtual comfort measures workshop or a mock labor session where we get together for an hour and we go over what we're going to do. We're going to do a pretend practice session of what it's going to be like when labor begins. You're going to get 1 to 2 postpartum sessions. It just depends on how you feel. Most clients are happy with one, but I offer a second one if you are interested in a follow-up after that first visit. I'm happy to do a second postpartum visit included with this price. And then you get support from me for the first 7 days postpartum. You also automatically get included in the Facebook group and invited to an adult or caregiver wellness circle. So whether you're pregnant, planning, or simply curious, go ahead and visit mybabylady.com and schedule that free consultation. When parents are prepared, birth is not something to fear, it's something to celebrate. So thank you so much for your time, for supporting My Baby Lady's mission, and for helping to empower families and improve birth outcomes. Together, we can make birth a celebration and not a fear. And again, sign up for my 3-part comprehensive childbirth preparation event today. Don't forget to schedule your free call and see how My Baby Lady can support you through your pregnancy, your childbirth, and your postpartum journey. Thank you so much.